Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Mary Ann Roberts, an RN and health educator with CDPHP. Welcome, Mary Ann.
Good morning.
First question, how long have you been an RN?
I've been a registered nurse for 33 years.
Wow, that's a long time. And tell me about the wellness program at CDPHP. What do you focus on?
We focus on community wellness and prevention. We look at the needs of the population, whether it be stress management, fitness, diabetes. We go out to the community to provide these programs free of charge. We also go out to our employer groups, some of our bigger employer groups, and we do worksite wellness because we feel that prevention is absolutely the key to keeping people healthy, keeping them well, providing quality of life for folks. So we go out to all of our service areas throughout New York State and provide free educational programs for our members.
Okay, today we're talking about diabetes. Do you want to talk about numbers, statistics of diabetes in the United States?
Absolutely. Currently, we know that there's 20.8 million folks that have diabetes. 14.6% of these folks, 14.6 million of these people have been diagnosed. The other 6.2 million are undiagnosed.
Wow.
And then further, we know that there's 54 million people in the United States that have prediabetes, and left untreated, they will gradually fall into the category of having diabetes. So definitely we want to approach the folks that have prediabetes to try and help them with lifestyle and lifestyle changes, medication compliance, to help prevent further progression to type 2 diabetes.
Okay, and what's the breakdown of age within that number? What about children?
Children. Currently, we are seeing there is an obesity epidemic with our children. And what that has fostered is a tremendous rise in type 2 diabetes in children. Mm-hmm. We don't have an exact number. The Center for Disease Control is working on multiple studies throughout the United States trying to obtain exact hard numbers to know how many children are affected. It used to be historically that type 1 diabetes, which is insulin-dependent diabetes, mm-hmm. We saw that in children. It used to be called juvenile diabetes. And type 2 diabetes was always considered a disease of folks over the age of 40. Now, again, with the epidemic of children and obesity, we are seeing type 2 diabetics in children. Type 1 diabetics make up about 10% of the population. The other 90% fall into the type 2 category. So the aim would be to direct our attention to children and weight management programs for children and healthy lifestyle choices for children, mm-hmm. to help prevent the children from going on to developing serious complications of diabetes.
Okay, and let's just try to define prediabetes and type 1 and type 2 in case our viewers aren't quite clear, mm-hmm. on the differences between them.
Yeah, prediabetes is defined as having a fasting blood sugar between 100 and 120.
Now, fasting means
a
person hasn't eaten.
They haven't eaten for 12 hours.
Mm-hmm.
They would go to their physician's office or to the lab and have a fasting blood sugar drawn. And when the results come back, if they're in that 100 to 120 range, they would be given that diagnosis of prediabetes.
Okay.
A physician could also choose then to do further testing and do a blood test 2 hours after the person had eaten a meal. If in that range, we're looking at 140 to 190. If the results come back in that range, the physician could make a diagnosis of prediabetes. Anything greater than that is considered diabetes. The type 1 diabetic is diagnosed, again, primarily we're looking at younger children, is primarily made on symptoms and then, of course, the elevated blood sugar. And when I talk about an elevated blood sugar, you're looking at blood sugars 300, 400, 500. Normal blood sugar is 70 to 100. So with that in mind, anything above 100 would raise a red flag that there needs to be further evaluation. So the type 1 diabetic, again, diagnosed through symptoms, through lab test, being the blood sugar. The type 2 diabetic, again, it's generally, we're looking at symptoms. We're also looking at blood sugars, and we're looking at adults. So if an adult presented, a 30-year-old adult presented with symptoms of diabetes, frequent urination, frequent thirst, they're always hungry, changes in vision, a sudden weight gain or weight loss, those symptoms, in addition to an elevated blood sugar, a diagnosis of diabetes would be made based on all of that. So it's not just one tool that a physician uses. He uses multiple tools to make that diagnosis.
Okay, so there's a difference between type 2 and pre-diabetes.
Absolutely.
Because pre-diabetes only has the blood sugar issue and not any of the other symptoms.
They haven't developed symptoms yet. What we want to do is we really want to aim at prevention. So when you're looking at the folks that fall in that pre-diabetes category, it's absolutely essential that we talk to them about nutrition, we talk to them about weight management, we talk to them about fitness, so that we can hopefully get their blood sugars lower. They can fall out of that pre-diabetes category. They may not need to go on to treatment. And we can certainly talk about treatment if you'd like.
The first thing I wanted to cover, you've talked a little bit about diagnosis.
Yes.
Signs and symptoms that somebody has a problem that might be a pre-diabetic or have diabetes. What are some of the signs and symptoms of that?
The signs and symptoms, again, would be the excessive thirst, excessive urination, excessive hunger, either a dramatic weight gain or weight loss, fatigue, blurred vision, changes in their orientation. They notice that they're having periods of confusion.
Confusion, okay.
Those would all be signs that something isn't quite right and an evaluation needs to be done. They need to be seen by their physician.
So when they're seen by the physician, what would the doctor's office do? What would they do?
Yes, the physician would do a complete physical exam. The physician would order blood work, and again, the blood work would be a fasting blood sugar. They may also send the patient on for a glucose tolerance test, which could be 2 hours or 4 hours, and that would be done in a hospital or in a laboratory. And they would actually be giving a very sugary drink, and then they would check their blood sugars every half hour for up to 2 to 4 hours to see where those blood sugars fall. Are they greater than 190? If you're not a diabetic and you drank this sugary drink, if your insulin would kick in, because our bodies produce insulin, the insulin would kick in and would lower the blood sugars, and you would have a normal reading. If you have diabetes, type 1 diabetes, your body doesn't make enough insulin. The pancreas just does not produce enough insulin to help control your blood sugars. And the only way that your body can use the food that you take in is through insulin. Insulin helps so that all of your blood cells can use that sugar and continue to function. So that's type 1. Type 2, we know that people either don't make enough insulin or the insulin that they make is not being utilized by the body. We don't know the cause. That's still a great unknown in the medical community. Why? But we do know that the insulin is there, not in high enough levels, and not being utilized correctly. Pre-diabetes, we know that you are making some insulin, but again, why is the body not using it appropriately? Why is it not being absorbed into the cells? The sugar is not being absorbed into the cells. Because again, looking at that level, if your blood cells aren't getting sugar, you're not going to be able to think. Your heart's not going to be able to beat. Your liver, all of your organs are not going to be able to function.
So generally you would basically just excrete the sugar.
Absolutely.
That's why you have the levels in the urine.
And in your blood. Because again, when your body produces insulin, the sugar then is taken out of your bloodstream and it goes to the cells in your liver, in your heart. If the insulin isn't there, the sugar just stays in your bloodstream, and that's why you would have a reading of 300 or 400. Your urine, if you were to examine the urine and they were to do lab tests on the urine, it would have high amounts of sugar in the urine. It used to be called spilling sugar, again, old days.
Yeah.
And it meant that the sugar wasn't being used into the blood cells.
Mm-hmm.
And insulin or medication is necessary so that you can, your body can use the sugar that it needs in order to function.
Okay, so once somebody's diagnosed
Yes.
with their ailment, what sort of treatment do they have to go through?
Okay. The type 1 diabetic would require insulin in order to manage their blood sugars. The type 2 diabetic would require oral medications, and in many cases may also need to supplement that with insulin. The pre-diabetic, the treatment would be lifestyle changes,
Mm-hmm.
definitely weight management, and close monitoring. Treatment also involves monitoring. The diabetic, the type 1 diabetic, we'll talk about that first. The type 1 diabetic, it's absolutely essential that they would check their blood sugars.
Mm-hmm.
They would use a monitor similar to this. There's several monitors out on the market. This just happens to be the one that we had at CDPHP, but there's several monitors on the market. The individual would have to monitor their blood sugar first thing in the morning when they get up before they've taken anything by mouth.
Which is a stick, right?
It's a finger stick.
Yeah.
They would put a drop of blood on the strip.
Mhm.
It gets put into the meter, and within 20 to 30 seconds, they would get a reading. And based on that reading, they would know how much insulin they needed to take. When a person is diagnosed with type 1 diabetes, the physician or diabetic educator, nurse practitioner, the healthcare professional, would come up with a diabetes action plan for that person and would give them a range. If their blood sugar is this, you take this much insulin. If your blood sugar is low, then you may have to cut back on the amount of insulin that you take. So the
Is that done on a daily basis?
Absolutely.
Oh,
The monitoring is done on a daily basis. So a diabetic, if they're looking for good control, they would check their blood sugar first thing in the morning. They would check it again sometime midday, generally before their lunchtime meal.
Mm-hmm.
Check it again before their dinner, and then again before they go to bed. So they would have minimally 4 readings that they would record. It's very, very important for a diabetic to record their blood sugars. We're looking at trends. Why is it that today I woke up and my blood sugar was 300? What did I do last night? What has changed? Trends in blood sugars also are a precursor to let me, the patient, know that maybe I'm getting sick. Many, many times, especially with the type 1 diabetic, there'll be a spike in a blood sugar. It may happen 1 to 2 days before the onset of illness. A cold, the flu, an abscessed tooth. Any of those triggers or insults to the body will change the insulin requirements for the person.
Mm-hmm.
So they get up in the morning, they check their blood sugars, they know what their blood sugar is, they take their medication, they would eat a breakfast, eat a meal, and then they can go on about their day. There's no reason why the type 1, the type 2 diabetic can't go on to have a productive life and do everything that they want to do. Be the athlete, be the mom, be the teacher, be the nurse. They can go on to do everything that they ever wanted to do. The type 2 diabetic, they get up in the morning, they also would be doing a blood sugar, and they would be on oral medications. There's multiple pills out there. Some folks are on 2 or 3 medications in order to control their blood sugars because each medication works a little bit differently. So they would take their blood sugar, they would take their medication. The type 2 diabetic then again may check their blood sugar before they go to bed at night. You're not looking at as close monitoring. They still need to monitor every day, but there's not the intensity that you see with the type 1 diabetic. Type 2 diabetics as well, if they have a sick day, they have the flu, they've had surgery, something has changed, then they would again have to monitor a little bit more closely to see where their blood sugars are. They would have already worked out an action plan with their physician, because that's very important. Everybody should have an action plan to know what to do on the well days as well as the sick days. Very important.
Now, let's say these people have to leave the house. Obviously, it's easier to stay home, I'm imagining, when you're a diabetic. But you have to leave the house. You want to stay active. So you want to go on the bike trail and ride 2 miles. I mean, what do you have to do?
You have to always be prepared when you go out, whether you have type 1 diabetes or type 2. But more importantly, with our type 1 folks, you always have to be prepared. You take a bag similar to this, make sure that you have sugar. This is orange juice. Okay. Candy, hard candy, definitely.
Not sugar-free.
Not sugar-free. You want sugar. You want to bring your meter with you, always. Now, most of us have cell phones. You'd want to make sure that you had some form of communication with you. A cell phone would be ideal, because generally when a type 1 diabetic runs into trouble, it's more that their blood sugar has dropped. Low blood sugar, hypoglycemia, synonymous. Generally when their blood sugars get below 70, they have symptoms of mental confusion. They may not know who they are, where they are, profuse sweating, tremors. They may feel very shaky, confused. They're unable to walk. They need to always wear identification. Whether you're type 1 or type 2 diabetic, always wear identification. Whether it's a bracelet, something around your neck, definitely in your wallet. You never ever want to leave the house without identification. Even if you're going out to walk the dog and you think you're going to be gone a half an hour, always make sure that you have identification on you to say, I'm a diabetic.
Because if somebody finds you on the street
Right.
and you're unconscious, that's the way that they know.
Absolutely, they would know. The type 1 diabetic, many times when their blood sugars are low or they're dropping, folks confuse that with the person being intoxicated. It's pretty much the same type. They may be staggering, they may be confused, sweating. So the lay person on the street, if you saw somebody that was sitting on the sidewalk, laying on the ground, and they were confused or shaky, and their behavior bizarre, could be very bizarre. You would think, well, they've had too much to drink. And a lot of folks make that determination without fully checking through to see, do they have a bracelet on? Do they have a necklace on? Do they have a medical condition? So before you leave the house, always make sure you have your identification. You're going grocery shopping, you're going to the mall, you're going on a trip. You always want to make sure that you have your supplies with you. If it's just a one-day outing, you're going to the beach, you're going to take your cooler bag with you. You're going to make sure that you have enough sugar drinks, sugar candy. A great treat to bring for yourself are peanut butter crackers, Peanut butter is a protein. It helps to raise the blood sugar, and the blood sugar will stay elevated longer. So peanut butter definitely is something that you would want to bring with you, peanut butter crackers, to help you in the event that your blood sugar dropped. You would want to make sure you bring your meter. Again, if it's a one-day outing, you bring your meter. You're going to bring extra strips, extra lancets, which is the device you use to poke your finger to get the blood drop. You're going to bring extra equipment with you to go to the beach. Have a great day. Make sure you monitor your blood sugars when you're out. If you're skiing, if you're doing physical activity, biking, you're going to go on a 15-mile bike trip. You're going to want to check your blood sugars a little bit more frequently. You're doing increased exercise, and there may be a fluctuation in your blood sugars.
And exercise is also very important.
Absolutely.
For managing, because if you're not exercising,
absolutely,
you're not going to do as well.
Absolutely. As far as packing a bag for long term, you're going away for a week, you're going out of the country, you're going to be flying anywhere, you're going to be on a cruise ship, you're going to want to make sure that all of your supplies are with you as a carry-on. You're going to need a prescription from your physician. With the airport regulations being what they are, you need to check with the airlines that you're traveling with or the cruise line, whatever mode of transportation. Check with them to see what the regulations are. But generally, a prescription is needed from your physician to carry your supplies on the plane, train,
so they can bring their insulin needles.
All of that can be carried very easily on a plane as long as you do some planning ahead of time and check, again, with the airlines or whatever mode of transportation to see what their regulations are. Always carry enough supplies. If you're going away for 1 week, carry 2 weeks of supplies with you. We've come to know now in the United States that things do happen, disasters do happen, floods, Hurricane Katrina, I mean, things do happen. So you always want to make sure that you have at least 2 weeks of supplies, double the amount of time that you're going to be away with you. Make sure that you always have food with you. When you are going on an airplane, you always have hard candy with you. Always, always, always. Something that's going to give your blood sugar a quick boost. And hard candy is definitely the way. You want to stay away from chocolate. Chocolate, you know, people think chocolate is real sweet. Chocolate just takes a very long time to raise your blood sugar. So you're better off with hard candy. It works much quicker, and you'll recover that much quicker.
So another aspect of management is also going to the doctor, seeing the doctor. What do people really have to be careful about with that?
As far as management of diabetes in general, you want to make sure that you see your physician on a regular basis. Keep your doctor's appointments. It's crucial that you see your physician and that he's monitoring your blood sugars. You're going to bring your blood sugar record with you to the doctor's office so he can see what your blood sugars have been like. Type 1 diabetes, type 2 diabetes. The pre-diabetics also are going to need to monitor their blood sugars at home. Bring those records with you to your doctor's office. That's first. Secondly, you want to make sure that you check your the bottoms of your feet on a regular basis, all part of management of diabetes, type 1, type 2 diabetes. As diabetes progresses, you've had the condition longer and longer, some diabetics lose sensation or feeling in the bottom of their feet. So they may not know that they've stepped on a tack, or there's a sliver in the bottom of their foot, or that they have a blister on the bottom of their feet. So they need to look at the bottoms of their feet every single day when they get out of the shower, out of the bathtub. It's recommended that they look at the bottoms of their feet. If for some reason they can't bend over, they can't see the bottoms of their feet, there's a diabetic foot mirror, which has an extended handle, and it's a magnifying glass at the bottom, and they can look at the bottoms of their feet. You want to make sure that you see the dentist on a regular basis. Again, diabetics are more prone to cavities, and so therefore you should see your dentist at least twice a year. You should have your eyes checked. This is part of Not only, it's part of prevention. Hopefully to avoid treatment down the road, prevention tells us that you need to see your eye doctor. There are visual changes that happen, again, type 1, type 2 diabetics. So in order to be proactive, see your eye doctor. Absolutely essential. Before, you talked a little bit about exercise.
Mm-hmm.
Exercise is, again, very important in the management of diabetes. Before you join a gym, before you start an exercise program, check with your physician to see if there's any limitations. Can you get into a pool? Are there any recommendations as far as if you wanted to walk on a treadmill for speed, for distance, the percent of incline? Very important. Just get the okay from your doctor to see if you have any restrictions.
Do you have any suggestions as to what sort of activity people should be doing, or does it obviously depend on the person?
It depends on the person, but basically everybody can walk. Walking is the best form of exercise that there is, and it takes special equipment other than a good pair of sneakers. Mm-hmm. And we'll talk about sneakers. Shoes, proper fitting shoes is absolutely essential for the diabetic. It's essential for all of us, but in particular for the diabetic because, again, they may have some decreased sensation in the bottom of their feet. A good pair of sneakers and get out and walk. If the person is chair-bound, they're not able to get up and walk, there are a whole host of exercises that they can do while they're sitting in their chair in order, again, to get some fitness, to get some exercise. Water exercises are absolutely perfect. Getting into a pool. There's a lot of area facilities that folks can go to that cost very little. Water aerobics is great because the water decreases some of the resistance, so it's a little bit easier to do. We find that water aerobics is actually good for folks that may be struggling with their weight. Getting into the pool and doing some exercising there can help with their weight. It helps with circulation. Diabetics, again, it's limitless to the type of exercise that they can do if they choose to ski. I want children to know that just because they have type 1 diabetes doesn't mean they're limited to the types of activities that they can do. Mm-hmm. They can do anything. All they need to do, again, is just to have a good handle on their blood sugars, monitor their blood sugars, and make sure they have their supplies with them. That's the most important thing. For our senior population, a diagnosis of diabetes doesn't mean that they need to be homebound. They can still go out. They can still go out to do all of the activities that they normally would do. But again, they need to monitor their blood sugars and make sure that they have food with them. Definitely.
So let's talk about prevention. Now, heredity, obviously you can't help heredity. If it passes down from your mother or father, you're going to be predisposed to have whatever
Correct.
that illness is.
That's one of the risk factors that you can't control for is heredity. But knowing that you may have someone in your family, mother or father, siblings, grandparents, that have diabetes, you need to then work on the risk factors you can control. The risk factors you can control, your weight, number one. The amount of stress, because we know stress also can affect. As a precursor, we know that heredity is there, but stress can sometimes be enough, the stress on your body can be enough to put you into that pre-diabetes mode. Mm-hmm. You need to, again, continue to be fit, good nutrition. All of these are risk factors that you can control. You can control what you eat. You can control your amount of exercise. And hopefully prevent type 2 diabetes down the road, definitely. In children, when you're talking about type 1 diabetes, there's not an awful lot. Type 1 diabetics in particular, it's hard to know whether a child is definitely going to develop diabetes. Because the mom has diabetes doesn't necessarily mean that the child is going to develop juvenile diabetes. That does not mean that. It means somewhere down the road they may develop. Prevention is key when you're looking at the type 2 diabetics or our children now that we're seeing that are having weight management issues. Education in school is absolutely crucial. Education in the community.
Right. Now, you've talked about the obesity epidemic, especially in children. What are the future implications going to be with regard to that 10 years from now?
10 years from now, if there are no changes in our society and we do not continue to address childhood obesity, we could see a 50% increase in the number of type 2 diabetics in children. It's very possible that that could happen. That's why we, CDPHP, we have a children's weight management program in addition to our adult weight management program. We're trying to work with children age 5 and up, trying to teach them healthy lifestyle, good nutrition, why they need to get up and move, why they should be out there riding their bike, playing, spending less time in front of the TV, less time in front of the computer, playing computer games. Some time is absolutely fine, but definitely we know that children that are more sedentary are at greater risk for developing obesity, which then leads to some chronic diseases such as diabetes, heart disease, asthma, respiratory conditions. So we really need to focus on our children and this whole epidemic that we're seeing, that we're in the middle of.
So let's talk about Capital District resources. What are some of the organizations that focus in this area of diabetes that you can recommend?
Yes, the Juvenile Diabetes Association in the Capital District is absolutely a wonderful, wonderful resource. Ellis Hospital has a program for children, the Sugar Busters, and that's a wonderful program, again, for our children. We're looking at the American Diabetes Association. They also have a Capital District site. You can find out you can look in the telephone book. You can check with your physician's office. Your physician should always be your first resource. Talk to your physician, their office staff, the nurse. Most physicians' offices have this printed material available, or they can direct you to where you need to go to get this information. There's no reason why you can't access these resources. There's telephonic. If you're homebound, you can't get out, you don't drive. There are resources available via the telephone. There are resources available via the internet that you can access to help you so that you don't feel so alone. One thing that is predominant throughout type 2 diabetes, type 1 diabetes, even the pre-diabetic, is this overwhelming feeling of being isolated, of being alone. They've just been given this diagnosis and it's very overwhelming. They leave their physician's office, the physician has told them, you have diabetes, now we want you to monitor your blood sugars, watch what you eat, we want you to exercise, and it can be very overwhelming.
I can imagine.
And I want to make sure that folks know to take it one day at a time and look at one piece at a time. The key would be to monitor your blood sugar. Get your blood sugars, get that piece under control. Know how to do this. You check your blood sugar, you've recorded your blood sugar. Then move on to the nutrition component and the fitness component. They all do need to fit together, but if you look at the whole picture, a lot of times it's very overwhelming for people and they just give up and they say, I can't do this, I don't want to do this, it's just too much for me. So what we try and do is we try and separate it all out. Take one piece, one day at a time. And the resources that I just mentioned will help with that feeling of isolation if they can talk to other folks, adults and children that have diabetes. They know they're not alone. We know that there's other people out there that are going through the same types of feelings, physical and emotional feelings that you have when you have that diagnosis of diabetes.
Mary Ann, you've given some very useful information today. Thank you very much for coming.
You're very, very welcome.
And following the program, we're also going to be showing the websites that you've mentioned as well. And
Wonderful.
our library does have a number of books and cookbooks that the patrons can also take a look at.
Fabulous. Thank you.
Thanks for watching. We hope to see you next time on Focus on Health.
Welcome to Channel 17, the Town of Colonie Government Channel.